Welcome to Dr. Arnold Dentistry, providing hometown dental care and restoration, committed to helping you make the most of your dental experience. We are a caring team of dental professionals. Our entire team is dedicated to providing you with personalized care, making every visit as comfortable and pleasant as possible. We also take pride in having a relaxing environment to meet your needs.
My name is Robert Arnold. I'm now in practice for my 25th year here in Marion, and here, a native of Marion, graduated high school here in 1981, and then went to Murray State University for my undergraduate work, and then went to dental school at Southern Illinois University at Edwardsville, graduated in 1989. And of course I wanted to come back home, and then there was the decision of, did I want to be a part of the old downtown or go back out where the new, everything out by the mall and maybe rent or build. And I just felt compelled. I wanted to be a part of the old downtown. There's so much history here. And so I bought an old building and renovated it. It took me a couple years to complete it, but I'm pleased with my decision. The staff is everything. I mean, I cannot do it without them. We see quite a few people on a daily basis, and everyone has their certain role, and it's definitely a team effort in order to accommodate the patient in a manner. There is so much involved in this field that has nothing to do with my hands being in the patient's mouth. If we're making a referral to another specialist, I mean, we have, I believe there's 8 employees here, and everyone has their own role, and we all know a little bit of the other's role in case we have to fill in for each other. But for the most part, everyone has their specific job, and we work well together. And many of my staff that's been here for many years. We have some new staff, but about half or more of the staff's been here for several years. The patients that come here, usually it's word of mouth, but they'll come in oftentimes on an emergency basis, and we'll get them out of pain. And then after we get the patient out of pain, and then look at the mouth and decide what it is that they're needing done, what they want to do. The average patient, we will have them come in and divide the mouth into maybe quarters, 1/4, we'll do 1/4 of the mouth at a time. So an extensive treatment plan may get into 4 or 5 settings, but the average patient, oftentimes within 2 or 3 appointments, we can complete their treatment.
We offer a full range of dental services, dentures and false teeth, including partials or full dentures, crowns, or caps. We offer hospital dentistry for procedures that cannot be performed in a regular dental setting, soft tissue management and deep cleanings, extractions, or pulling teeth.
We have an in-house lab here that I'm proud of, because if something needs to be done in a timely fashion, then we can do it right here. We do have several lab technicians that we work with in the area, and I have a good relationship with them. They're very good. If I say, hey, we have a situation, I need this back this afternoon, or I need it first thing in the morning. This person has a musical or a school event, we need it. Have what's needed here to go back in my laboratory and go ahead and do that repair, not just put a temporary situation, but actually complete it. Whereas oftentimes in a dental office setting, that may go to your lab technician, and it may be a 3, 4, 5 day turnaround. If you speak to my patients, find many of them will know that, tell you that I like to joke with them, and I play jokes on them sometimes. So dentistry, is I try to break the ice and play and keep things on a light level. It certainly helps break the ice. I love to while we're talking, and the next thing you know, say, well, we're done. They didn't. It's kind of a distraction technique also, but makes them feel more at home. My average week, I am here Monday through Thursday from 7 a.m. to 7 p.m. That's when I am here. On Fridays, I am available. I usually am here doing lab work and paperwork. I do not schedule patients on Friday, but for those people that call in on Fridays that have an emergency, I will usually tell them, hey, come on in, I will take care of your problem. But usually on Fridays, lab work, paperwork, I do one-on-one training with staff. We're always doing, continuing ed and training. And on Saturdays and Sundays, when patients call my office, it directly links you into my cell phone, and to be able to accommodate them if needed, if it's something that cannot wait till Monday morning. And I usually coordinate a time, usually around noon or at 6 o'clock that evening, so that I can see the patient.
For information, call 618-997-9005.